Good day everyone. Now we discuss about what is your take on the following questions. So number 1, what is your opinion on the government's approach and strategies in addressing the drug issues in the country? So the approach and strategies of governments in addressing drug issues have varied significantly across different countries. Some governments have focused on a more punitive approach, utilizing strict enforcement measures and harsh penalties for drug offenses. Other governments have shifted towards a more public health approach, emphasizing prevention, treatment, and harm reduction strategies. One specific example of a government's significant achievement in combating drug-related issues throughout history is the United States War on Drugs campaign initiated in the 1970s. While the intention was to reduce drug use and trafficking, critics argue that the approach has disproportionately impacted marginalized communities and fueled mass incarceration. This highlights the importance of considering the unintended consequences of government strategies in addressing drug problems. So, it is crucial to recognize that the effectiveness of government approaches in addressing drug issues can vary depending on various factors, such as cultural norms, socio-economic conditions, and political landscapes. For instance, some countries have successfully implemented harm reduction programs, such as needle exchange programs and supervised injection sites, which have been shown to reduce the spread of diseases and overdose deaths among drug users. It is essential for governments to consider the root causes of drug issues, such as poverty, mental health issues, and lack of access to education and opportunities. Addressing these underlying factors can help prevent drug abuse and addiction in the first place. Collaboration between government agencies, healthcare providers, community organizations, and policymakers is key to developing comprehensive and effective strategies to combat drug problems. It is important for governments to prioritize evidence-based approaches and allocate resources efficiently to addressing drug issues. Investing in prevention programs, treatment, service, and rehabilitation facilities can help individuals struggling with addiction to recover and lead healthy lives. By approaching drug issues with compassion, understanding, and a focus on public health, governments can make significant strides in reducing drug-related harm and improving the well-being of their citizens.
In your opinion, what is the best way to address the nation's drug problems? What specific areas require attention to address this persistent problem? So, in my opinion, the best way to address a nation's drug problems is through a comprehensive and balanced approach that considers both supply and demand reduction strategies. Prevention efforts should focus on education, awareness, and community-based initiatives targeting at-risk populations. Treating and harm reduction processes should be widely accessible and evidence-based, addressing the individual needs of those struggling with substance abuse. Specific areas that require attention to address the persistent drug problem include addressing the underlying social determinants of drug abuse, such as poverty, unemployment, and lack of access to healthcare. Governments should also prioritize the integration of mental health services with substance abuse treatment to provide holistic care to individuals struggling with addiction. Access to treatment. So expanding access to treatment services, including mental health support and rehabilitation programs, especially for underserved populations. So this includes integrating treatment into primary healthcare settings. So harm reduction. So promoting harm reduction strategies such as needle exchange programs and supervised consumption sites to minimize the health risks associated with drug use. So law enforcement reform. So reevaluating drugs laws to focus on public health rather than punitive measure. So this could involve discriminalizing certain substances and relocating resources towards treatment rather than incarceration. So, community engagement. So, encouraging community-led initiatives that foster resilience and support for individuals and families affected by substance use. And also, by the help of sports activities, we all know the very popular in our country. So, especially in our barangay, by the help of our Sangguniang Kabataan, they will provide the finances to control and give the attention to the teenager and to be part of that sport activities in that way. So, in that way, so the teenager or even adult can prevent attention to illegal activities. So, additionally, investigating in research and data collection to inform evidence-based policies and programs is crucial in addressing the complex nature of drug issues.
In conclusion, addressing a nation's drug problem requires a multifaceted approach that considers the complex underlying factors contributing to substance abuse. Governments should prioritize prevention, treatment, and harm reduction initiatives while also addressing social determinants that influence drug use. By adopting evidence-based strategies, investing in community-based solutions, and prioritizing the well-being of individuals struggling with addiction, governments can make a significant strides in combating drug-related issues. It is essential for governments to continuously evaluate their approaches, learn from past experiences, and adapt their strategies to effectively address the persistent challenges associated with drug problems in society.